Good morning, everyone. I'm Lori Vick, and welcome to our winter series of webcasts to help us stay in touch and informed about important topics in healthcare. Today, our theme is Your Partner in Orthopedic Care, Summa Health Orthopedic Institute. We're pleased to provide this unique opportunity to all of you, our dedicated supporters and friends, to present an insider's view of the leading-edge orthopedic care and advances in surgical, non-surgical, and minimally invasive procedures that are offered right here in our own backyard. Now, before we get started, I'd like to zoom in our special guest, who is Dr. Thomas Feil, who will share the latest information about vaccines, a topic that, boy, we are all interested in and it's on the top of a lot of your minds in recent weeks. Dr. Feil is the chair of Infectious Disease Division and co-director of the Antimicrobial Stewardship Program at Summa Health. Welcome, Dr. Feil.
Well, thank you, Lori, and welcome to all who are on this webcast as well. As you mentioned, we're going to spend a little bit of time about the vaccine, and it's certainly good now that we have vaccines that are available and are being administered. These first two vaccines have been very effective. I mean, it's remarkable when you consider 95% in reducing disease, and they're safe. And I encourage all of our viewers to receive the vaccine when it becomes available to them. And briefly, I'd just like to go over some of the most common questions that we've been receiving about the vaccine. So I hope that this will provide some information to our viewers. So first of all, what are the side effects? Well, I think we have to acknowledge that almost all of the recipients, all of us who have had the vaccine, will experience some type of reaction. And these are expected, and they include soreness at the injection site, maybe some achiness, some fatigue, arthralgias or joint aches, and then even some low-grade fever. And with the second dose, it probably is even somewhat heightened. But these are transient, and they are indication that your immune system is working. So in a sense, it can be a good thing that the immune system is doing this. Number two, a question I often receive is, will these mRNA vaccines change my DNA? And the answer definitely is no. The RNA in the vaccines, they stimulate our own cells to produce antibodies against a part of the virus. But the RNA then is quickly gone. It disintegrates. So it never is able to enter the nucleus of our cells, and therefore in no way can affect our genetic makeup. So that's not going to be a concern. Next, a very common question, and a pertinent one now, is what is the efficacy of the vaccines against these variants that you've all heard about? And there's many variants, and it's just very common for these RNA viruses to have some mutations as they go through populations. And so it's not unusual to see these variants. But so far, evidence is that the vaccines are going to protect against these variants, and particularly the one that comes from the United Kingdom. Now, you may have read or heard that there is some information that maybe the South African variant, there may be some reduced antibody levels. However, those antibody levels are still very adequate to be protective. Next, I've had COVID-19. Should I receive the vaccine? Because we acknowledge that you will receive some immunity from natural infection. But the answer is yes, because when you receive the vaccine, you're going to boost your immune system so that you have a longer acting, more potent immune reaction against this particular virus. So as long as you've resolved your acute illness of the COVID disease, and you're no longer in the isolation period, it's okay, and we recommend that you get the vaccine. Next question is, when will I be fully immunized? And that will be after the second dose, usually about 2 weeks after the second dose. So it's very important when you take these mRNA vaccines, which require 2 doses to get your best optimal response, that you do go ahead and schedule your second dose and go ahead and get that vaccine for the second time to make sure that you have your best response for protecting yourself. Next is, what's the duration of immunity after the vaccine? Well, we don't know that yet because obviously we're just administering the vaccines now. The studies have just been following patients for about 2-4 months now. We hope obviously it's going to be prolonged, but we'll just have to follow and see what the studies are to see if we need a booster at some time in the future. Now, here's another question. It's very important. Can I transmit the virus after receiving the vaccine? And I just want to remind our viewers that the efficacy of the vaccine was based on preventing disease. We're not absolutely sure if it prevents asymptomatic infection. And that's important because we know that people who are asymptomatic can potentially transmit it. There is indirect evidence that indeed the vaccine will reduce asymptomatic infection and therefore transmission. And there are ongoing studies to clarify that. But I think that's going to be very important. And I really think that it is going to show that we reduce transmission as well. But that's very important because the last question I want to deal with is, well, Dr. File, do I still have to wear a mask? Do I have to social distance? Do I have to avoid large crowds after I get the vaccine? And the answer still is yes, in part because what I just mentioned, because we're not absolutely sure that the vaccine will prevent this asymptomatic infection, which can lead to transmission. I think it will. Once we have that data, we'll be more, I guess, problematic or not, well, definitive about it, actually. But then also there's the issue that a certain percentage of patients may not have good antibody response. I mean, the 95% efficacy is fabulous, but that still means that some people may not respond. So I think those are the most common questions that I receive. I think, again, it's just really important for all of us to receive the vaccine when we can. The greater the percentage of the population that receive the vaccine, the better we're all going to be protected in our community, and we can get back to some semblance of normalcy. So I wish you all the best, and go and get your vaccine, and stay safe.
Thank you, Dr. File, for that important and really timely update. So much good news involved there. And for more information regarding vaccines, please remember you can visit summahealth.org/vaccine. And now it's time to welcome our expert leaders to share their insights. First, we have Dr. Derek Klaus, orthopedic surgeon at Summa Health, and Dr. Scott Weiner, chair of the Summa Health Department of Orthopedics and medical director of the Summa Health Orthopedic Institute. And doctors, you can feel free now to remove your masks at this time because we are following proper social distancing protocols here in the studio. And remember, folks at home, we want this to be an interactive session. In the past, we've received really terrific and insightful questions during our webcasts, and we look forward to your participation today as well. Please type your questions into the Q&A panel, which is shown on your screen. The Summa Health Orthopedic Institute is well known for helping our patients get on the road to recovery faster, treating all conditions for bones, joints, cartilage, ligaments, muscles, tendons. Now, before we hear from our experts who've just been introduced, let's have a look at the story of one such patient, David Pence, who recently underwent double knee replacement surgery with Dr. Pefferly.
I'm an extremely active person, and my knees were getting so bad, my legs were so bowed, that I couldn't do the activities that I love to do. Playing and running with my grandkids, playing the game that I love of baseball, and I didn't want to live life like that. I actually played baseball with Dr. Scott Weiner from Summa Health, and during one of the ball games, he looked at me and said, "We can fix those knees." Dr. Weiner referred me to Dr. Pefferly, and he said, "You are bone on bone, and we need to replace those knees." My surgery was done at Summa Barberton. The care and the nurses there were unbelievable. One of the things that Dr. Pefferly uses is a pain ball instead of narcotics, which really helped to ease a lot of my pain. I'm back playing baseball. In fact, we won the championship. But the biggest win of all is I'm now able to run and play and chase my grandkids. That's the best thing in the whole wide world.
It's just one of dozens of patient care stories. Many of them are in orthopedics that you're going to find by visiting summahealth.org/care. You know, whether an injury is recent or has been getting worse over time like David's, Summa's orthopedic specialists provide patients with treatment options, including the latest non-surgical and surgical approaches. And I'm sure, Dr. Weiner, it was great to see your baseball buddy doing so well now. And in another webcast, perhaps you could talk about your championship playing
Sounds
field.
good story with that one.
But first, launch our discussion, if you will, Dr. Weiner, with an overview of the Institute and tell us about the new and incoming orthopedic specialists on board.
Yeah, so first, on behalf of the entire Summa family, the Orthopedic Institute, we want to thank everybody for coming on this call and participating. I also want to thank you for all the support of our department. The group we've built is based on what the community's needs are, and I've heard from many of you that are on this call about what we needed at Summa to be able to provide the services that we can do excellent care. Basically, we developed a team that's been very excellent, and I think we have the new docs on there. So we added 4 new physicians to our team. We are the fastest growing orthopedic group in our region, and we can provide a comprehensive operative and non-operative care for patients, as most of you know. And an important part of that continuum is primary care sports medicine, our advanced practice providers. So our group has grown to 12 surgeons. We have 5 primary care sports medicine that do non-operative orthopedic surgery, and we have 8 advanced practice providers. And so we have a pretty good team of providers that take care of patients. The 4 new docs this year, Matt Jekyll is an orthopedic spine surgeon who joins Dr. Inkrot as part of our team. Jacqueline Tulajetsky, she's a podiatrist, our first employed podiatrist that's working very closely with Dr. Junko and our advanced practice provider in foot and ankle. Ryan Urchek is an orthopedic sports surgeon who joined our team this year. And Zach Vallandingham joined our team as a primary care sports medicine doctor. And these are awesome additions. And I can't even go into, we're adding 7 additional providers in 2021, including 2 surgeons, 2 primary care sports, and 3 advanced practice providers. So our group is growing, it's very large, and we're able to take care of all the needs of our community. And also important that our base location is at White Pond, and we're doing expansion at White Pond to provide better care and more access to that region. But more importantly, we have satellites set up all over the area. We have Green office, Barberton office, Medina, Fairlawn, Hudson, Talmadge, Wadsworth, and Rootstown is just opening up. That'll be based at the NeoMed campus at the medical school, which will be a great tie-in for us educationally and patient care-wise. The system has an urgent care solution, and the urgent cares in our system have direct access to us orthopedic surgeons that are on call, that we can handle any of the needs that come into the urgent cares that we provide. You'll hear a little bit more about the Joint Replacement Center of Excellence that's underway, that we're getting started with. Slowed down a little bit with COVID, but now it's picking back up. That's going to allow us to provide cutting-edge operative and non-operative care for joint problems. We're very advanced with anesthesia, nerve blocks, and as Dave mentioned in his video, that pain control after surgery has been so great that we're able to send patients home. I think 80% now within 24 hours, or sometimes even shorter than that. We're doing cementless total knee arthroplasty with Dr. Pefferly and Dr. Combs. We're getting into robotic assisted surgeries, all cutting edge stuff. We do hips, knees, ankles with Dr. Junko, which are pretty unique. And shoulders, you'll hear a little bit more about reverse shoulder technology that Dr. Klaus has brought to our service. And you're going to hear more from him talking about that. And one of the other advances that we've had is we've had minimally invasive spine surgery. But everybody says they have minimally invasive spine surgery, but we do, Dr. Inkrot and Dr. Jekyll do muscle sparing spine surgery. So the length of stays are less. They still have pain after surgery, but that's improving and improved over the big open techniques. But muscle sparing surgery is something that Dr. Inkrot and Dr. Jekyll have brought to us. And again, we work as a team, especially with spine, because a lot of those patients, you really can't help too much with surgery. But our primary care sports team, our pain management team, we're hiring a physiatrist. They will all help with all the non-operative care of patients. So the patients that need surgery will have excellent care, but not everybody who doesn't need surgery will get surgery. And finally, with St. Thomas emptying in the next year, we're moving our orthopedic department and our 20 residents over to the Akron City campus into a new office and a new conference center. And I think you'll see a rendition of that. So here's a rendition of our conference center. It's going to be, especially with all the distance learning we're doing nowadays, we have to be more adept at this. And so this will allow us to broadcast to all of our different campuses and our offices and be able to transmit nationally and regionally our educational programs. And I think it's going to be a great addition. So that's going to be at the Akron City campus, and that's an area that can be supported down the road. But we'll ask more questions down the road. But that's all I have from my standpoint.
Wonderful. It's great to see all these advancements in treatment and, of course, the increase in the staff, the growth in the staff. That's super exciting. And now let's turn our attention to Dr. Klaus, and who, as Dr. Weiner mentioned, specializes in hand and upper extremity surgery. Dr. Klaus, can you share some of the new orthopedic treatments that you are especially excited about?
So as you alluded to, I do hand and upper extremity surgery. So majority of my practice is located in the hand and wrist. Also have an interest in the elbow and shoulder, particularly shoulder replacements, and we'll talk about that here in just a second. But at our Orthopedic Institute, we do a lot of cutting edge technology with regards to hand surgery. I think two of the highlights that are probably worth mentioning would be how we address carpal tunnel syndrome, which is by far the most common condition that we see in the office. Many times we can get patients better without surgery with splinting or injections, but for those select patients that don't improve with conservative care, where their hand symptoms are affecting their quality of life, we do have a good surgical option for them. And that is in the form of what we call endoscopic carpal tunnel release. So the gold standard historically was to make an incision centered in the center of the palm and actually work our way down through the skin, down through a couple layers, and release a tight ligament that's pressing on the nerve. That leaves you with a scar in the center of your palm, a little bit more postoperative pain, but good long-term relief. Endoscopic carpal tunnel release is a technique where we use a small little camera, make a cut back before the wrist crease, and actually go, into the center of the palm with a camera, looking up at the ligament and releasing it, effectively taking pressure off of the nerve without having to place a large incision in the center of the palm. So patients that undergo this technique have a faster return to work, less postoperative pain, and just a quicker overall recovery. The second thing we're doing with regards to hand surgery is wide awake local anesthesia only. And this is good for patients with trigger fingers, tendon injuries, nerve injuries, carpal tunnel as well, where we can actually have a patient come into the operating room without any anesthesia at all and have numbing medication placed, have their procedure performed with them wide awake without any pain at all, and then send them home. They can drive themselves. They don't have to fast. There's no preoperative testing. So that's a good solution for a lot of problems that can be solved without anesthesia.
And I know you brought some props with you, but before we get to that,
Sure.
we have a question from one of our viewers, and
Sure.
this is, I had to have, and correct me if I'm not pronouncing this correctly, iliopsoas tendon release. Is this something that Summa can do?
That is something that we do. It's not hand or upper extremity, but it depends on the specific cause. Our total joint surgeons, Dr. Pfefferly and Dr. Combs, see a lot of patients that have iliopsoas symptoms after hip replacement or not after hip replacement. And so that's a procedure that we can offer. Doing it arthroscopically at this point in time, we don't offer it arthroscopically, which is kind of a newer technique. But this summer, we've recruited a surgeon that's going to join us that'll be able to offer that technique. And it's still under investigation, the arthroscopic nature.
Great, thank you for that. And Dr. Klaus, this question is referring to you, and this question comes from Martha, who says, I have numbness in my thumb and index fingers that is worse at night. Is this something that could be seen in the office?
Absolutely. So that's going to be carpal tunnel syndrome, and that's what we were just discussing. The carpal tunnel nerve lives in the center of the palm, and it basically gives sensation to the thumb, the pointer finger, and the index finger. Patients typically have a little bit worse pain at night because we sleep in a flexed posture. Doesn't really matter how we go to sleep, but we all end up kind of with our wrist flexed. That puts additional pressure on the nerve, and then we can wake up with numbness and tingling that causes, the pain that would actually wake people out of their sleep. Treatment for that would be wearing a splint at night to prevent your wrist from flexing. Again, if you come into the office, there can be given an injection that can give people significant relief of their symptoms. This is a very, very common condition. Sometimes it comes and goes. Sometimes it does end up with the surgery, which is what I kind of discussed earlier with a carpal tunnel release. But absolutely, if that's something that a patient's dealing with, could and should be seen in the office.
Good advice from Martha. And then now let's turn to the props that you brought along. And this is
Sure.
in reference to shoulder replacement surgery or shoulder surgery. And
Sure.
explain what you've got going on there. It looks fascinating. Dr. Weiner said before, it looks like something out of Star Wars.
Yeah. So this is just some of the newer technology as far as shoulder replacements go. The past year or so, we've gotten better at using 3D mapping software preoperatively to help plan the position of our components. So if this were a model of the shoulder itself, what we can do before the surgery is actually obtain a CT scan and get a 3D model of the bone structure itself. I can plan the procedure prior to using software, and then in real time in the operating room, I can use a device that actually latches onto the glenoid or the bone socket in whatever position that I plan preoperatively. And through this device, I can use a wire to basically localize the center of the scapula or the shoulder blade. And then based off of that pin, which this would be a simulated place, I can decide basically where to put my components, which has been determined ahead of time. So for this software, like I said, it requires a preoperative CAT scan, but we've gotten really good down to the degree of where we put our components to ultimately improve functional outcome.
Things like using CAT scans and planning and robots to assist takes away some of the guesswork. You know, you can do a lot more preoperative planning, and then the instruments that are developed by these companies and the surgeons are able to use are able to make more accurate. You know, hate to say that you cut the bone when you have your surgery, but most people out there know that we cut bones to fix them. And same with joint replacement, you have to cut the bone, and the more precise you can be, the better long-term results we think there's going to be out there. So Dr. Klaus is on the cutting edge of the, especially this type of procedure.
Sure. Wonderful. That's remarkable stuff. And also, I hear a lot about reverse shoulder surgery. And explain what the difference with
Sure.
that is.
Yeah, so here's a good model of just that. So again, there's a reverse total shoulder option, which is really becoming more and more popular as of late, as far as patients who don't have a good functioning rotator cuff. So for this option, I guess I should demonstrate the total first. For a total shoulder replacement, which is seen with, for a total shoulder, which is seen with basic wear and tear arthritis, where the ball wears down and the socket wears down, we can replace that joint by, like Dr. Weiner says, making a cut in the humerus, and then actually relining the socket with a high-tech plastic liner. And with this, we can have your typical ball and socket functional recovery. For a total shoulder, a standard total shoulder, you have to have a good rotator cuff function for this to work. If you don't have a good rotator cuff, then there is what we call a reverse total shoulder, and it's exactly that. It's reversing the components. We're putting the ball on the socket side and the socket side on the ball side. And in this construct, you're actually lengthening the arm a little bit. It's more of a constrained joint, but you rely entirely on your deltoid muscle, which is a muscle that's not affected with rotator cuff disease, to power the arm around. So this is good for patients without good functioning rotator cuffs, or patients who've had previous rotator cuff surgery which has failed, or patients with arthritis that's too advanced to perform a standard total shoulder.
Great. And Dr. Klaus, we're having quite a few questions coming in
Sure.
about arthritis, and especially in the hand and wrist. So I'm going to combine a couple of these questions for you.
Sure.
And this is from Christine, who says she has arthritis in her thumbs, bone on bone. Do you do joint repair / replacement for this, and what's the length of recovery? Now, coupled with that, Linda is asking what's the best remedy for daily arthritis pain in the hands and wrists if it's just stiff and there's some inflammation. So I imagine there are things we can do before we would go to replacing the replacement surgery, as you alluded to before, but give us the highlights.
Sure, yeah. So I see a lot of patients with hand arthritis. Typically doesn't affect just one joint. It's usually multiple joints. The thumb is very, very common, but Non-operative treatment for hand arthritis, there are several good treatment options. The first is a good anti-inflammatory, whether that's over-the-counter or prescription strength. That works at decreasing the inflammation in multiple joints and can alleviate stiffness and pain. As far as other interventions that aren't surgery, there are good injections that we can do in the office. That's typically depositing a steroid or an anti-inflammatory into the joint that is in question or in pain. And then to the question about the thumb arthritis, that is a very, very common location for pain and arthritis and disabling hand function in general, because you use our thumbs for everything. For that, there are splints you can use, there are injections, and there is a good surgery for that. It's called a thumb replacement or a thumb arthroplasty, but it actually involves removing the arthritic bone and interposing a little bit of tendon, a little cushion or a bumper at the base of the thumb to alleviate that pain.
Great. Now, this question is for either of the doctors. What type of treatments, and this is from Joe, what types of treatment options do you do for avascular necrosis?
So you can have that of the hand as well, but you're probably talking more about the knee and hip. And our doctors do take care of that problem. They're very difficult problems to treat because the conditions that lead to the osteonecrosis or avascular necrosis are usually long-standing, so it's hard to correct the underlying cause. Once the damage is done, then there's some techniques that can be used, but honestly don't have the greatest results. And unfortunately, most of the time, the long-term result for osteonecrosis is joint replacement, whether it's a hip replacement or a knee replacement. And so the damage is done before we even recognize there's a problem with those patients.
All right.
Good
Complicated issue. Diane is asking of Dr. Klaus, how have you treated Dupretens contracture?
Yeah, great question. So Dupretens contracture is a condition where the layer in the palm just beneath the skin starts to contract. And what you end up having is, typically it starts in the ring finger, small finger, it can be any of the digits, but the fingers start to flex into the palm. Patients have a hard time extending their hand, getting it into their pockets, doing daily activities. So a newer advancement with treatment of that disorder is if you do have a contracture of your finger, there's a medication called Xiaflex that I've been using pretty exclusively in the office for the majority of my patients with Dupretens contracture. Medication that can be injected into that tough cord into the hand. It's designed to dissolve or soften that cord, and then the patient comes back a day or two later. I numb the hand up in the office, and then I'm actually able to manipulate the finger and break that cord up to restore function. So in the right patient, in the right type of contracture, the injection is a good option. If the contracture is significant, if the joints are more significantly involved, sometimes that requires a surgery where you go in and actually remove that tough cord that's causing the finger to contract.
Great, and thank you for correcting my Latin is not as
Sure.
good as it was in high school. Been a while. Dr. Weiner, you mentioned before the new conference center, which is so exciting on the Akron campus. And so that brings to mind is the great significance of the residency program here at Summa. You are a product of it. Many of your staff are. And I think the remarkable thing is that folks who start their residency here at Summa in orthopedics end up staying their whole career.
Yeah, it's a blessing and a curse at the same time. We have 4 residents a year. We have 2 primary care sports fellows a year. And I would say 80% of them would like to stay in our region. Unfortunately, there's only so much room in Akron, Ohio between us and our other hospitals. And they're all very good. And as you mentioned, I think, 85% of the orthopedic surgeons that work at Summa Health are trained by Summa during the residency program, but we all went away and did our fellowship somewhere else. So we went away and got some advanced training and then loved Akron, Ohio so much. Dr. Klaus is from Wadsworth. I'm from West Akron. We both went to public school. We love Akron, Ohio. And a lot of our group is that. And some of our group wasn't born here, but did their training here and decided to stay in the area because their families loved it. So take great pride in our residency program, and it's one of the reasons that the care in Akron, Ohio, no matter what hospital you go to, is excellent, because there's a lot of homegrown talent that stays in our area and provides excellent patient-centered care.
And the new campus conference center is really instrumental in providing the great training for that residency program.
Yeah, it's going to be great, because now our residents are spread out to other locations, and rather than coming into one place and having their conferences and educational sessions, we can do it more remotely, and we've learned how to do that a little more effectively now with COVID. But in the long run, I think distance learning is going to be important. We have several national conferences. I give an orthopedic oncology course that's attended by 150 residents all over the Midwest, and if we can do that remotely, they don't have to travel to Akron, Ohio for a day and a half of conference. So we're going to be exploring the distance learning, and that's an area that we're planning on growing, which will augment our education and our professional development and our research interests for our department.
That's terrific. And the conference center is going to be technology facing forward, isn't it? That's
facing
terrific.
Forward, and we've had some very kind donations. So we've upgraded our audio visual capability to be almost top of the line. Hopefully Sam got us the top of the line. We'll find out. But anyways, kind donations from the foundation using their funds is really taking us to the next level.
And that brings us to our final question for you, Dr. Weiner. How can viewers support the Summa Health Orthopedic Institute?
We have a lot of things going on. Obviously, the orthopedic residency is where we focus most of our fundraising, because it costs a lot to do excellent education. We're also going to get into faculty and professional development, not just nuts and bolts stuff, but how to better take care of patients, to be more diverse, to adhere to everybody's needs across the system. So a lot of education and infrastructure needs to be put into that. So besides just buying books and videos, doing some other things with speakers and that. The conference center, can always use upgrades and different things with that. Our research program right now is in somewhat of a lull, but now we're going to have a new location. We're probably going to inspire that. So research is obviously very important. The Joint Center of Excellence will certainly need some upgrades, and there's going to be some construction going on at the Barberton campus and eventually in the Wadsworth campus. And so there's always going to be need for amenities, education, patient-centered things, programs that are not in operations that'll help patient care, setting up like an Uber Eats that'll deliver food to the family and stuff. That's not something that the hospital probably should be paying for. And that's something that our donors and our department can potentially help with, maybe not helps the care of the patient directly, but makes that patient experience better. And we all know if a patient has a good experience, then the results often are a lot better with that too. So.
Well, thank you so much. It's been really exciting over this last half hour and plus a few minutes to learn about the exciting advances at the Summa Orthopedic Institute and what the future holds. So it's terrifically exciting. And we thank you, Drs. Weiner and Dr. Klaus. And we also want to thank all of our viewers today. And now we might not have gotten to all of your questions in the time we have allotted. So please continue to write your questions in, and we will refer them to Dr. Weiner and Dr. Klaus and get back to you with some responses. In recent months, we've heard from so many of you who want to support Summa Health in so many ways, as Dr. Weiner spelled out to us. And for more ways you can help, please visit the Foundation's website at summahealth.org/foundation. And also in the next few days, you're going to be receiving a survey link via your email, and your responses are going to help us as we plan for future topics. So thank you in advance for responding to our survey, and we invite you right now to please join us, put it on your calendar for an exclusive webcast about the nationally acclaimed cardiovascular care offered through Summa Health. And that will be at 11 o'clock again on a Wednesday, February 17th. So mark your calendars, that's Heart Month. And for more information, please visit the website, which is shown on your screens right now. Thank you all for tuning in, and please be well until we see you again.